Ann Arbor Inclusive is produced in part with the Ann Arbor Commission on Disability Issues and CTN. The views and opinions expressed in the show do not necessarily reflect the views and opinions of the Commission or CTN. For more information about the Commission on Disability Issues, visit a2gov.org/disability resources. If you have program topic suggestions, please email a2disabilityissues@gmail.com.
Hi, thank you for joining us on Ann Arbor Inclusive. I'm your host, Tom Holtland. Ann Arbor Inclusive is a program of the Ann Arbor Commission on Disability Issues. We're glad you're here. Today's subject and highlight is something that may have touched your life personally or in your family or friends and loved ones, and that is mental health and substance abuse. We have found a great organization with a unique approach to serving and treating substance abuse and also highlighting and taking care of folks with mental health issues. New Oakland Family Centers has a unique mantra of the right care at the right time. And Dr. Phil Pittman is our guest today, and he'll be explaining exactly what that means. At New Oakland, they emphasize the importance of working with the whole family and treating each family member with integrity in and of themselves. So with that, I'd like to welcome Dr. Phil Pittman.
Well, thanks so much for having me, Tom. Appreciate being here. Thank you so much.
Yeah, for sure. So why don't we just start right out with asking tell us a little bit more about New Oakland Family Centers.
Sure, absolutely. So New Oakland Family Centers is it's an organization offering a continuum of mental health services. And as Tom mentioned, we're working with children, with teens, with adults, really focused on, as our name suggests, the family. And been around since 1990 as an organization. We were founded by a longtime child psychologist. His name was Dr. Ishmael Sendi, very well respected in the field. And he believed in creating a place where kids and families could come together, get the support they needed or the support they need to overcome whatever their social, emotional, or mental health challenges might be. And so that was his mission. And he, unfortunately, he did pass away a few years ago, but his sons, so it's Kevin, Greg, and Jeff, they're the ones carrying on the family legacy now. And so they continue to lead the organization. And as Tom mentioned, one thing that we work exceptionally hard to provide is the right care at the right time. And so for us at New Oakland, we focus on person-centered, proactive, preventative, early intervention approaches, holistic approach for child, adolescent, and adult populations. And so we do emphasize working with the whole family, and that's our mission. That's our purpose. That's why we exist.
Okay. So I read up on a lot of your programs and services, and there are a lot. And I kept using the word unique because it's some things I haven't seen before. So do you want to talk a little bit about the support services that you guys provide?
Sure, yes. So for us, our program, so outpatient therapy is a key thing that we offer. So people who would benefit from seeing a therapist on a weekly basis, monthly basis. So it's a core part of what we offer, outpatient therapy. And then we also offer some more intensive programs and some more unique programs, as Tom said. So we have the face-to-face partial hospitalization program, and that's a program we're really proud of. And that's a higher level of care. It's a program that runs from 9 a.m. to 3 p.m., Monday through Friday. And our Livonia location actually runs on Saturdays as well. And we have different groups set up for different ages. So for our kids, we have an elementary age group. We have middle school, we have high school. So those are 3 separate groups. And then we have an adult group as well. And sometimes if we have enough participants, we subdivide our adult group in kind of by age category as well. And that face-to-face program is considered a partial hospitalization program because it's a full day each day. And most people are with us for about 2 weeks in that program for very specific support from a team of professionals. So on staff, we have nurses, we have psychiatrists, nurse practitioners, therapists, behavioral technicians. So we have a whole host of people, and that provides that higher level of care. We call that face-to-face. In our Livonia Center, we offer a substance abuse program that's set up in a similar manner. In our Farmington Hills location, we have an eating disorder treatment program. And even though those are in different communities, we offer transportation. So for our face-to-face programming, we baked into the whole program is we have a van, comes right to your door, picks you up. Of course, people can drive or drop off their children on their own as well. But that transportation piece is something that not a lot of places are able to offer. We do offer telehealth online counseling and support. We work with schools very closely. We do educational presentations. We help with inpatient referrals if people need more support. We do integrated case management. We have a 24-hour crisis line. And so we're busy, and we're trying to provide whatever kind of supports people need. And we're a large enough organization where we do have a considerable bandwidth, but we also are a family-run organization in the sense that we're light, quick, we're nimble. We can customize approach for individual patients who need something specific.
Okay, so I think we've both touched base just a bit on who your clients are.
Yes.
But could you tell us a little bit more about who you serve? We understand the age groups, but who are they as individuals that need your services?
Yeah, so we work with a number of folks. Anxiety and depression are probably the biggest concerns that we're helping to treat. Also, ADHD is something that many of us struggle with. Learning disability, substance abuse, trauma and abuse is a big one as well. So those who have a history of traumatic experiences, abuse, neglect, any type of mental health illness, including more severe bipolar types of challenges. So really it is a full spectrum. And as you mentioned, so the full age group, about half of our clients are under the age of 18, are kids, and the other half are adults of all ages. And so insurance companies are the ones who essentially help support our services on the financial end. And we take all insurances. So that's your private insurances like Blue Cross, Blue Shield, HAP, and the like. And then we also take public insurances like Medicaid. So we essentially, when I say everybody, I really do mean everyone who could use a little extra assistance and professional support.
Okay, all right. So the right care at the right time.
Yeah.
Let's talk about how that came about and what it means to you folks.
Sure. So one thing that we've realized, and this really, it wasn't necessarily me personally, but from the very beginning, Dr. Sendy recognized that when people are having a mental health concern, especially a crisis, they need help, the right kind of help, and they need it now, right? So not 3 weeks from next Tuesday. And so constantly as an organization, one of the things that echoes in my mind, any and every meeting we have, is all about how can we provide the right services, the best services, and how can we compress time out of the system. So in terms of right care, so we have a continuum of services that we provide, and I mentioned several of those things, but we have a diverse clinical team as well. And so we have folks with a variety of specialties, speak different languages, connect with different types of clients. And so that's also helpful. We integrate with physical health services, and we partner with a number of providers across the region. So there are some things that we don't provide. So we're not a 24-hour facility. We're not a substance abuse detox program. We do offer substance abuse services, but those are more as a co-occurring disorder, along with, so we really work to treat the core issue. And oftentimes the substance abuse is more of a symptom or a coping mechanism. So we do partner with various providers that offer additional services that perhaps we don't. So that's something that we're a good team player across the community. And more, and this is a little bit connected to my role too, is some of the education piece on mental health related topics. So all of that helps combine to form that right care portion of what we do. And then the right time, we have a 24-hour crisis line. And that's an underrated part, I think, of what we offer. So anytime, day or night, 7 days a week, holidays, doesn't matter. We have a group of 10 plus master's level social work, counselors, therapists who man our crisis line. And so anyone can call. The number is 877-800-1650. And that's a number that is highly valuable. So if someone's struggling and needs support and need it now, can contact us and you'll be talking with a therapist immediately. We also offer walk-in appointments. So during business hours, can come right into our clinic, any of our centers, and you can get an appointment typically within an hour, if not sometimes sooner. Sometimes a little bit longer, but it's in some cases with mental health, people are oftentimes directed to the emergency room, right? Call 911 or go to the emergency room. And there are times certainly where that's warranted. If it's not an immediate life or death crisis, in many cases, New Oakland may be the right choice, because with a walk-in appointment, you can see a professional upon entrance practically. And that's also in this time of COVID. And we're operating with all the protocols, following all the guidelines. But we also offer telehealth. And so for those people who need our support, aren't able to come in or would prefer to work remotely, we have major telehealth options that have been a big plus for us. I mentioned the transportation for some of our programs, the face-to-face program. So that's huge. And even when it comes to psychiatric evaluations or med reviews, someone who needs to see a doctor, so a psychiatrist or nurse practitioner who has prescribing powers, for anyone in our face-to-face programs, they'll see a psychiatrist or nurse practitioner within 24 hours, which is hard to fathom. And I'm telling the truth, that's real. Right. And even for someone who maybe doesn't have that dire of a need, but they still need someone to do a more sophisticated evaluation, we can typically offer those within 3 weeks, which again is unheard of. For psychiatrists to get a psychiatry appointment, it typically takes months. Right. And so that's something that is all a part of how we can do these things at the right time. That is one of our key differentiators, I would say.
That's amazing that you could talk to a professional within an hour, maybe.
Yes, I know, and that's
unheard of.
That's legitimate. I'm not just saying that to only to impress you, but that's our organization is tailored towards a rapid turnaround to get people help and support.
Yeah, not only is it right care at right time, it's right place at right time.
Yeah, thank you. Yes.
So tell us about your footprint. You are not only in Ann Arbor, you're a lot of other places. Let's talk about where you are in Michigan.
Sure. So we have 13 centers across Michigan. So one in Ann Arbor, we like to joke about how we're now coast to coast. So we just opened up in Port Huron and in Grand Rapids. So we're west to east. We're highly concentrated here in southeastern Michigan, but have locations in Flint, in the Lansing area, Macomb County, Wayne County, Oakland County. So our Ann Arbor Center is our one Washtenaw center, and that's one of our newer locations. So came in the fall of 2019, and we're at corner of North Maple and Dexter. So we're in that M14 I-94 corridor. Across, kind of diagonal across the street is the Veterans Memorial Sports Complex. Other corner is Maple Village Shopping Center. We're near the library. I've actually, pre-COVID, I actually would swing by the library oftentimes in and out of our Ann Arbor location. And then a touchstone for me is we're close to Skyline High School, so about 5 minutes away, and we've done a lot of work with Skyline and a number of the other schools in Ann Arbor. So nice spot right there, situated in Ann Arbor, but also across the state. And our hope as we continue to grow is that we want to be within 20-25 minutes of people to the extent possible. And so we have a lot of requests to move farther north, Traverse City area. And so as time goes on, we'll continue to expand the organization. So because there are a lot of needs, a lot of mental health, social emotional needs out there, and we want to be able to help.
And I imagine all those locations are on your website.
They are, absolutely.
Yeah. Yes. Yeah. And so how would someone that sees this program and sort of identifies with some of the things that you're talking about, how do they get a hold of you? What's the process of being seen?
Sure. So phone call is great. So specifically for our Ann Arbor location, the direct line number there is 734-669-3610. So you can call our Ann Arbor office. You can set you up with an appointment. You can walk right in the door, as I mentioned. What's the fastest service is to call ahead of time and let us know you're coming, and then pop in the car, head our way, and then we'll be ready for you. And upon entry, we do some of those COVID protocols, take your temperature, ask a few questions, that kind of thing. And then we get you to see a therapist for an intake appointment to understand what the concerns are. We also have an 800 number. That's, I already mentioned the crisis line, but we also have a regular 800 number. And because some people, based on where they live, one location might be a better fit than another. So our 800 number is 395-3223, and the 3223 is FACE if you're actually looking at the letters. And that's intentional from our face-to-face program. So phone calls are a great way to get started. And then also, like I said, you can just stop right in and see us. If you need some support at any time of day or night, that the crisis line is the best way to go. And our crisis folks will help talk through the situation. And also if there's a severe need, that might entail a 911 call. It might entail, there are times where we do have a mobile crisis unit who deploys. And in some cases it's doing an initial intake and then preparing the way for the person to join us in one of our locations first thing the next morning. So those are the best ways. And we serve a lot of people. So right before we came together here, Tom, I looked at some of our data, and last year we saw 35,000 families in Michigan across our locations. So that's pretty remarkable. So that's about 300,000 touch points, like essentially appointments. And that's something that we're really proud of. So we're working hard to serve as many people as we can. And it's not, but it's not about the quantity. It's about providing quality care for people who need it, and providing the holistic view that will assist them and their families.
And I'm wondering, is Ann Arbor your hub? Is that where you see the most people?
So Ann Arbor, I'll tell you what, from the moment we opened Ann Arbor, it's right around Thanksgiving time of 2019. And from the moment we opened the doors, we've been busy in Ann Arbor. So it is, as you look at our growth curve, sometimes some of the other locations we've opened in the last few years, it's been a little bit slower growth curve as people are finding out about us, who we are, what we do. And in most places, it's a little bit more gradual. With Ann Arbor, I mean, we were moving right away. And for one, it's there's a nice sized population in the community, but also, and also people who recognize the value of mental health care and services. Yeah. So because of those things, and some of the other providers, there are other providers for mental health services in Ann Arbor, and some really phenomenal ones. But in some cases, what we've heard from our Ann Arbor folks is a lot of times it's pretty hard to get an appointment in a timely manner at some of the other locations outside of the New Oakland system. And so that's, I think, part of the reason too, that people in Ann Arbor really appreciated the timeliness of being able to get support, to get care. So Ann Arbor is across the organization. Ann Arbor is sort of like the young upstart of the organization, and in many cases the envy of the other centers. Great facility. So really well appointed, very nicely set up, and we're able to work with a number of families there on a regular basis. So we're excited about that and proud about that.
Yeah, that's great. I mean, Ann Arbor does have a very diverse population, and yes. And by saying that, we have a large disability community.
Sure.
So some of the folks, most of the folks that you see are categorized as having disabilities, and whether that be short term or chronic or so forth. But can you tell us briefly what your role at New Oakland is?
Yes. So my official title is education consultant. And I'm a former educator. So I started off my career as a teacher. So I was a high school English teacher. And actually I should mention, before that, I student taught in Ann Arbor. So at Forsyth Middle School, taught 8th grade language arts over there, great place, and a feeder school for Pioneer. And then went into high school English teaching, administration from there. So I was high school assistant principal, then elementary principal, working with the younger students. and then I became a curriculum director. And so it's a little bit of my progression. I thought I wanted to be a superintendent and realized that while that's a really important role, not necessarily the one that I should spend the rest of my career in. And so for me, I have a son on the autism spectrum. And so been able to enjoy a really rewarding journey with him, and also a challenging one. And so that's something where mental health challenges have always been important to me, but that's one that's, you mentioned, Tom, earlier, that, you know, probably all of us have been touched by mental health concerns in one way, shape, or form, personally, or our loved ones. And so for me, certainly, you know, I have my own challenges. We all do. And then my son with autism was a big part of my decision to step out of a formal education role in public school system and instead help connect to students, families who are in need in the mental health arena, and be a connector to the support they need. And so as education consultant, I work very closely with educators. So teachers, social workers, school psychologists, administrators. In some ways, it's helping to troubleshoot challenges. Okay, so this is, you know, just talking through issues that people might be having or seeing. In some cases, providing professional development around mental health issues. And that's, so there's a survey that Michigan principals completed, and the number one area of concern and area for future focus from principals were mental health related concerns. And so that's something that educators throughout the state, and COVID has provided a number of complications in this area. Mental health issues can significantly interfere with learning. I mean, no surprise to any of us. And so if socially, emotionally, behaviorally, mentally, if there are issues that are impeding learning, we want to take care of those, right? So that the student lives a healthier life all the way around, and also is able to learn at high levels. And so I have a cool role in that I have kind of carte blanche to do whatever it takes, whatever schools need to best serve their kids and families. I hope to provide that. And that's part of the nimble aspect of our organization. So currently I'm spending my mornings working directly with students. We have a program that integrates mental health with education. And so I coordinate the educational part of that. So the teaching learning portion, and then our therapists and licensed professionals in the mental health world, they're taking care of those mental health concerns. And so that's part of what I get to do, working with upper elementary into the teenage years students directly. In some cases, it's talking with students about trying to eliminate the stigma around mental health. And Ann Arbor is a really open-minded place. That's one thing that we really appreciate about Ann Arbor. But there are still a number of folks who feel that there's a stigma related to getting help. And so that's something that we're trying to help people recognize, that there's the right thing to do is get help when you need it. And that's becoming more accepted, including and especially among our young people. So this current group of students are more open and accepting of people getting help. That's not a big deal to kids generally these days, which is really cool to see. So I'm doing my best to help continue to spread that message to our kids. And so kind of a far-reaching role in a lot of ways, but one that's really cool, really rewarding. And I've been able to help shape that role too. So I was the first person in that role, and 4 years deep now. So it's gone fast, but 4 years in the role, having a ton of fun, and working hard to do meaningful work for our kids, families, and schools around the state.
I think it does sound like a great, diverse, fun job. Yes. What you're doing.
And every day is different. Every conversation is different. Every day is different. And I like that. That keeps it fun, keeps the pace high, which is great.
Do you see more youth than you do adults, or is it even, or?
It's pretty close to even, but 55% youth and 45% adult.
Okay. All right.
And that can change though. There are, so one thing that's interesting is for our kids, we see an uptick anytime before or after a school break. For instance, we see, in terms of higher level of need that pop up, school break. So before summer break, after summer break, Halloween, in the Halloween season, Thanksgiving time, the holiday break in December, any of those times where there's a change in routine, it's remarkable how the numbers reflect those kind of challenges. And our students are the ones who are most vulnerable to some of those changes. Not that adults aren't, but our students are, those structures are really important for our kids, more so than perhaps we even recognize as adults, even though typically adults are a little bit more structure oriented. For the kids, anytime there's that disruption, that leads to a need for higher care.
Well, that's a great segue before we go, is to talk about if someone is seeing this or wants to share with someone else, a friend or family member, and they have concerns, what's their best bet for, reaching you and, feeling comfortable in that process?
Yes. And so depending on what the level of need is. So in a heightened level of need, our 24-hour line is the best starting place. And that doesn't have to mean that someone's in the midst of a life or death crisis, but rather they do need to speak with someone right now. So that 24-hour crisis line is a great place to start.
Okay.
If it's something where, okay, I've been feeling more anxiety, I know that something isn't quite right. If it's that kind of feeling where they know something's wrong, or they recognize, okay, we do need to address this, then calling the 800, the typical 800 number, or our Ann Arbor clinic specific phone number is great, or stopping right in. The key is to no need to wait. We'll see you right away, and you're not alone. Also, right? The mental health challenges are pervasive
Yes.
of all types. And so there is no stigma to it. We have the right professionals to help you. We'll match you up with a clinician who will suit your needs and meet your personality style and what the challenges might be. And we'll help walk alongside you through your journey to get into a better place in your life. So a key thing is to any of those steps, phone call or come right in and get the process started.
Yeah, that's great. I think one of the biggest assets that you talk about is, of course, your footprint in the state of Michigan, and your unique programming for children, youth, and adults. But this service that you can talk to someone very soon,
Yes.
that might be in a crisis situation is really valuable.
Yes.
Because I've been in situations where I've seen families struggle with not being able to be seen for a month.
Right.
And these things can't always wait.
Yes.
So
100%.
Well, it was really great meeting you today and highlighting New Oakland Family Centers. And you've given us phone numbers that we can that we'll be putting into the to the program. And I really thank you so much for telling us about the centers. And I know that it's going to touch someone and make a difference in someone's life.
Delighted to be here. Thanks so much for having me. Really proud to be here. Thank you, Ann Arbor Inclusive. Really appreciate it.
And that will be it for us today. This is Tom Holtland. I'm your host of Ann Arbor Inclusive. We are a program of the Ann Arbor Commission on Disability Issues, and we hope to see you here right here next time on Ann Arbor Inclusive. Thanks.